psychosis or a symptom? What are the three major psychotic disorders? And what are the basic neurotransmitters involved in this condition? What are the predominant antipsychotic medications in clinical settings? Upon completion of this lecture, you shall be able to define psychosis, define positive and negative symptoms of schizophrenia, possess a basic understanding of neurotransmission involved in this diagnosis, and have a better understanding of the basic psychopharmacology, and be able to recognize common physical sequelae that may cause psychosis. Neurotransmissions that have been linked to schizophrenia include dopamine, glutamate, and serotonin. According to the original dopamine hypothesis, schizophrenia is due to high levels of dopamine or hyperactivity of dopamine receptors. Evidence for this hypothesis is provided by academic research showing that amphetamines increase dopamine activity and produce schizophrenia-like symptoms, while drugs that decrease dopamine activity reduce or eliminate these symptoms. Brain abnormalities in schizophrenia are associated with schizophrenia and include enlarged ventricles and hypofrontality, which refers to lower than normal activity in the prefrontal cortex, and it is believed to contribute to disorders of negative and also cognitive symptoms. One model of schizophrenia that is consistent with the revised dopamine hypothesis previously described implicated cortical and also subcortical regions. It predicts that dysfunctions in the temporal limbic frontal network causes the negative symptoms of schizophrenia, as well as disinhibition in subcortical areas of the brain that in turn increases the release of dopamine in the striatum, to be specific in the caudate nucleus, the putamen, and the nucleus accumbens, and causes that of what we call positive symptoms. In terms of major clinical features of differential diagnosis for practical purposes, there are three psychotic disorders, and they are described as follows. The first one, schizophrenia. The second one, psychotic mood disorders. And the third one, psychosis associated with neurological conditions. In terms of diagnosis, before discussing differential diagnosis, let's first briefly define psychosis. Psychosis in reality is not an illness, it is a symptom associated with a number of disorders. The hallmark of psychosis is impaired reality testing. In other words, impaired ability to accurately perceive reality. Now, the loss of contact with reality can take many forms. The loss of reality is, for example, our severe confusional states, delusions, bizarre, unrealistic thoughts, hallucinations, delusions, and marked impairment in judgment and also reasoning. Psychosis. Now, please do remember that psychotic does not in itself imply a specific etiology. What I am trying to encourage all of you to retain is the fact that there are many variations to the causation of psychosis. Now, once again, schizophrenia, psychotic mood disorders, and psychosis associated with neurological conditions. Now, these psychotic disorders mentioned are distinguished by the following characteristics. Schizophrenia. Schizophrenia is generally a recurring illness. People diagnosed with schizophrenia are prone to repeat psychotic episodes. Now, it is helpful to think about three types of schizophrenia. First, let's explore positive symptoms of schizophrenia. And this type of schizophrenia is also referred to as dopaminergic schizophrenia because of the presumed etiology, a hyperactivity in the dopamine system. Now there are two subtypes, Positive symptoms are active with gradual delusions and hallucinations, agitation, and also emotional discontrol. Now, schizophreniform disorder, which is a brief psychotic reaction, this disorder looks like schizophrenia, but it remits quicker and often does not reoccur. The second one are negative symptoms per se, and this is a recurrent or a chronic disorder. Now, negative symptoms in schizophrenia. This is a neurodevelopmental disorder. In fact, negative symptoms include flat or blunted affect, anhedonia, which is the inability to experience pleasure. Another predominant negative symptom is marked as a social aloofness or withdrawal from social contact or interaction. In the negative symptoms of schizophrenia, there is an absence of occurring forms of delusions and also hallucinations. The negative symptoms in schizophrenia tends to have an earlier and more gradual onset. So the symptoms tend to develop gradually as to be well established before becoming apparent. As children, these people were often seen as odd and aloof. Now, psychotic mood disorders. The second disorder for practical purposes is psychotic mood disorder. Both mania and depression can present with poor reality testing and other psychotic symptoms. Psychosis associated with a neurological condition is also another diagnosis, and many acute metabolic and toxic states can result in delirium. As for example, head injury occasionally produce transient psychotic behaviors in several degenerative diseases. As for example, Alzheimer's can produce periods of agitated confusion. Now, we're not going to cover neurology in this course because it is not within the scope of this class. Nevertheless, it is important to distinguish such conditions from schizophrenia and mood disorders. Now, damage to Wernicke's area, which is the superior temporal lobe, can occasionally result in what looks like schizophrenia reaction, where language and thinking are grossly impaired. Now, in terms of neuropsychology and differential diagnosis, keep in mind that Wernicke's patients have terrible time naming objects. They experience a condition that is called anomia. And people with schizophrenia and mood disorders do not. But when we begin to think along these lines, we need to develop a referral question so that we can test the referral hypothesis with neurological testing. So consider referring your client to a neuropsychologist. Now, treatment of mood disorders that present with psychosis or psychotic symptoms, if you will, are primarily involved in treating the depression with antidepressants or electroconvulsive therapy and adding antipsychotics to control the psychotic symptoms. Now, common disease and disorders that may cause psychosis are Addison's disease, trauma, folic acid deficiency, CNS trauma such as Cushing's disease, Huntington's chorea, multiple sclerosis, pancreatic disease, systemic lupus, multiple sclerosis, dementias, and anemia, which is a vitamin B12 deficiency. Now, common drugs that may cause psychosis are anti-inflammatory drugs such as steroids, anticholinergic drugs such as anti-Parkinsonian drugs such as amphetamines, hallucinogenic drugs such as LSD, or many over-the-counter cold medications are also implicated in psychosis. Now, target symptoms. It is helpful to subdivide schizophrenic symptoms into 4 categories. The first one are positive symptoms. The second one, disorganization symptoms. The third one, characterological traits that have to do with personality. And the fourth one are negative symptoms. Schizophrenic symptoms are positive symptoms, delusions, impaired thinking, hallucinations, confusion and impaired judgment, severe anxiety and agitation, and also emotional discontrol are some of the symptoms seen in schizophrenia. Now, negative symptoms, on the other hand, are flat or blunted affect, poverty of thoughts and concentrate thinking, emptiness and anhedonia, where the client experiences no joy, psychomotor retardation, blunting and perception, where the client experiences insensitivity to pain. So when do we prescribe medications? Though many general practitioners treat anxiety and depressive disorders, most patients presenting with psychotic symptoms should be referred to a psychiatrist. These patients are often hard to treat, and in fact, many psychotic patients can be treated in an outpatient basis. However, hospitalization might be necessary. Antipsychotic medications, also referred to as neuroleptics or major tranquilizers, should be started when early signs of psychosis or psychosis symptoms appear. Now, some episodes of schizophrenia may be gradual. Positive symptoms of disorganization are the primary target symptoms for the treatment of antipsychotic medications. Now, such drugs do little to affect the characterological traits or also the negative symptoms in the client. Now, choosing the right prescription. All antipsychotic medications are equally effective in the ability to reduce positive symptoms in schizophrenia. If the patient is gaining weight, if there are some physical symptoms that display metabolism syndrome, then we need to pay attention to that. And on this point, we need to address the side effects of neuroleptics or antipsychotics, if you will. Antipsychotic medications have 5 primary side effects which must be taken into consideration. The first one is sedation. The second one, it's going to be anticholinergic, in other words, meaning restlessness, akathisia, lip smacking, etc. Sedation to include dry mouth, etc. And then the final one would be considered an extrapyramidal effect, where we begin to see problems with movement and muscle control. Now, before choosing a medication, assessment of the patient's motor state is necessary. Psychotic reactions that present with marked agitation may require more sedating drugs. So psychiatrists tend to use fewer sedating drugs for psychosis with pronounced psychomotor retardation and also withdrawal. This is the general rule of thumb, but there are exceptions based on symptoms that are presented by the client. Now, antipsychotic medications, in terms of low potency, Thorazine is normally prescribed in a range of 50 to 1,500 milligrams, and sedation is high. Quetiapine, also known by brand as Seroquel, it's normally prescribed in a range of 100 to 750 milligrams, and sedation is high. Now, high potency antipsychotic medication, I will present 2. It's, for example, paliperidone, also known as Invega, normally prescribed in a range of 3 milligrams to 12 milligrams, and sedation is high. Now, haloperidol or Haldol, which can be used in an intramuscular format, it's normally prescribed in a range of 2 to 40 milligrams, and sedation, of course, is low. Now, clozapine is a low potency antipsychotic, and it improves negative symptoms in schizophrenia. On this note, I would like to add that clozapine is effective in treating resistant schizophrenia and improves negative symptoms. Now, there is evidence for clozapine in treatment-resistant mania, but also be cognizant that this medication can also cause neuroleptic malignant syndrome. In fact, clozapine-induced neuroleptic malignant syndrome is less likely to manifest with extrapyramidal fissures such as rigidity and also tremors. The incidence of clozapine-induced agranulocytosis is between 1% to 2%. Now, referral to a psychiatrist and not a general practitioner is important. Psychiatrists must always take into consideration anticholinergic and extrapyramidal side effects. The most common cause for relapse is poor compliance or premature discontinuation because of the unpleasant side effects. The key to successful psychopharmacological treatment rests on how well the patient handles the side effects. Teaching these clients social skills and engaging them in psychotherapy is also beneficial for them. In terms of closing thoughts, in this lecture we have revised the major clinical features of differential diagnosis. We have also addressed schizophrenia and other types of psychosis. We have also addressed common diseases and disorders that may cause psychosis. Moreover, we have discussed schizophrenia and symptomology. On a final note, brain abnormality as it pertains to schizophrenia was also discussed. On this note, I sincerely wish you the very best. Best of luck in your professional endeavors, and thank you very much for your cooperation. Goodbye.